Welcome to Mr. Leek's free science tutorials. Now this question itself now is quite a topical question that students often like listening to and like talking about. Right, but obviously what we're doing is we're then talking about it from a legal drug stage. Now the question here is, explain the process of testing a drug to make sure it is safe from the preclinical trials to stage 4 testing on humans. So basically what it's talking about somebody in a laboratory somewhere comes up with the drug. Right, a drug could be any sort of chemical, right? It'd be very similar to something that's then been used before. And what they'll do is they'll then test it. They will test it through numerous stages. And then eventually, or the final stage, is stage 4 testing on humans. Now, in this question, it also talks about use the following words: efficacy, toxicity, and dose. And what we'll do is we'll go through what each of those individual words mean. Now, firstly, what is a drug? Now, people think about cocaine, heroin, LSD, all those different drugs themselves, right? But there's also hundreds and hundreds of different drugs around. Think about caffeine in your coffee in the morning, nicotine in cigarettes, paracetamol, aspirin, all those are individual drugs. Now, what a drug actually is, it's a substance that causes a physiological change to a human body or to a body. So physiological means physical change. So paracetamol, you take it in, and what it does, it takes away the pain. If you take in illegal drugs, that'll then have a physical effect on the body. Now, traditionally, drugs were extracted from plants and microorganisms. And this is the way that many of the most successful drugs on the market today have been developed. Digitalis, right? Basically, that was extracted from foxglove plants and used as a heart drug, right? So lots and lots of foxgloves. I've even got foxgloves in my back garden. All right, and that is then used as a heart drug. Aspirin, quite incredibly, right, is a painkiller and anti-inflammatory that was first found in willow bark. So at some point, somebody discovered that willow bark, right, took away pain, and anti-inflammatory means take down swelling. Penicillin, very famous antibiotic that was discovered by Alexander Fleming from the penicillium mold and used as an antibiotic. So what it was is, theoretically, one time he left some plates that had some bacteria growing on it. Another bacteria landed on it, which was penicillin, and he noticed that that new penicillin was killing off the bacteria that were already on the plate. Quite an amazing discovery. Now, what I'm going to do now is go through the process of testing a drug to make sure it's safe from the preclinical trials to stage 4, testing on humans, and the words efficacy, toxicity, and dose. Now, basically, drugs have to be tested and trialled before to check they are safe and effective. There's no point in having a chemical, right, that is the cure for cancer, but then it kills every other cell in the body, right? There is no point in doing that. Now, there's no point in taking a drug that makes you iller than the actual problem that you have in the first place. Now, firstly, before we talk about preclinical trials, new drugs are extensively tested for 3 main things. Firstly, efficacy. Now, what efficacy means is make sure the drug works. Like I said before, there's no point in taking a drug if it doesn't work. What's the point in taking a pain relief drug if it doesn't take away the pain? Toxicity, check that the drug is not poisonous. You could take the most wonderful pain-killing drug in the entire world, but it kills you. So there is no point in taking that drug. So what they have to do is they have to look out for toxicity. The dose is then, once you found that the drug works, the efficacy, you found that it doesn't cause massive amounts of damage, the toxicity, what you then have to do is you then have to do the dose. This is then the most suitable amount to take. And what they'll do is there'll be human trials that we'll talk about in a minute, where some people could take a small amount, some people take a large amount, and basically what you do is you find out the best dose that makes the drug work and doesn't cause you any problems. Now, looking at the question again, the process of testing a drug to make sure it is safe from preclinical trials to stage 4 testing on humans. So, a preclinical trial, clinical means testing on humans, is using cells, tissues and live animals. They must be carried out before the drug can be tested on humans. So the very, very first stage of the 10,000, 100,000 new drugs that are made every single year is they'll test them on cells. And what they'll do is they'll get some human cells, right? And what they'll do is they'll add the drugs to them. If those drugs kill those cells, then the drug's never going to work. If they see something positive happening and those cells are doing what they expect them to do, then what they'll do is they'll test them on tissues. So a tissue would be maybe a larger amount of cells. If it then looks still promising with that, with the efficacy and the toxicity, they will then test them on live animals, tending to test them on smaller animals first, like your mice, and then eventually they may well test them on larger animals. But these must, by law, be carried out before the drug can be tested on humans. Once the preclinical trials have been completed on cells, tissues and live animals, it then goes into the stages of using healthy volunteers and patients. Now, key to it is healthy volunteers. Okay, so stage 1. Healthy volunteers try a small dose of the drug to check it is safe and record any side effects. So what there is there's these clinical trials and people will get given a very, very small amount of a drug, say it could be a heart drug or a cancer drug, and what they will then do is they will make sure that it isn't causing them any major problems. So healthy people, there's no reason why a heart drug would affect them, right? And if it does, then there's obviously an issue with the drug and they'll get rid of it. If there is no toxicity or efficacy issues, then it would then move to stage 2. Stage 2 is a small number of patients try the drug at a low dose to see if it works. So now what we're doing is we're talking about patients. These are then the people that have actually got the disease, the affliction, or however we want to term it. Once stage 2 has then gone through, right, to see if it actually has any impact at all, then there'll be stage 3 as a larger number of patients, different doses are trialled to find the optimum dose. So we've gone through efficacy to make sure the drug works. We've gone through toxicity to make sure it isn't a strong poison. We're now onto the dose. So this is when a lot of people take it, all at different doses. It might be from 0% to 100%. 100% may well be way too much. 0% is obviously not going to work, but 38% may well be the ideal dose or the optimum dose. Stage 4 is a double-blind trial will occur. Now, double-blind, a blind trial, is the patient doesn't know what they're getting, right? Because some patients may well get a placebo, and a placebo is the tablet that then doesn't have any of the drug in at all. So, for example, I could give somebody a paracetamol placebo, right? And the test is whether their headache goes away. If their headache goes away with a paracetamol placebo, right, then there's something unusual going on. A double-blind trial is then when the doctor, whoever is actually giving the medicine, doesn't know what is actually being given, right? Because I could say, right, if I was the doctor giving somebody some paracetamol and say, here's your paracetamol, it's a placebo, so it ain't going to make any difference, right? That then takes away the fact of any influence of anybody else. The patients are divided into groups. Some will be given the drug and some a placebo. Once stage 4 has then gone through, that will then be ready for applying and marketing to the wider community. So, explain the process of testing a drug to make sure it is safe from the preclinical trials to stage 4 testing on humans. Use the following words: efficacy, toxicity and dose. So really in that question, what you need to do is you need to talk about the preclinical trials are where drugs are tested on cells, tissues and live animals and must be carried out before the drug can be tested on humans. Stage 1 is where healthy volunteers try a small dose of the drug to check it is safe and record any side effects. That is where they are looking at the toxicity. A small number of patients try the drug at a low dose to see if it works. That is then looking at the efficacy of the drug. Stage 3 is then a larger number of patients. Different doses are trialled to find the optimum dose. So stage 3 is then looking at the dose. Stage 4 is looking at the efficacy, the toxicity and the dose and see if it is worth actually doing in the final stages. So that then answers the question about drug trials from preclinical to stage 4.